Hey everyone, and welcome back. Today we're going to be doing a deep dive into something pretty incredible. We're going to be looking at how AI is already changing medicine, like not in the future, but right now.
Yeah, it's pretty mind-blowing stuff.
Right. And to guide us through this, we've got a fascinating 2020 perspective piece from the Frontiers in Medicine Journal.
Really forward-thinking piece.
It is. This piece really opened my eyes to how AI is, like I said, already changing the game in healthcare.
Absolutely.
From how doctors are diagnosing illnesses to how patients are being monitored.
All right.
It even touches on what we even consider healthy these days.
It's a whole new world, isn't it?
It really is. And what's amazing is we're not talking about, robot surgeons just yet. This is about practical AI applications that are already out there.
Yeah, tools that are being used every day.
Exactly. Like there's this app that can detect atrial fibrillation.
Which is a type of irregular heartbeat, right?
Exactly. And it can detect it better than routine doctor visits.
More effectively, yeah.
Way more effectively. They even cite a study, the Rehearse-AF study, that found this app to be 20% more effective.
That's significant.
Right. But there's a bit of a caveat there, right? The study compared the AI to, like, routine care, not necessarily to, cardiologists using every tool they have.
Yeah, that's a good point.
But it still makes you think, like how this kind of AI could be used for early detection of conditions like atrial fibrillation, which can be hard to catch in regular checkups.
Yeah, for sure.
And then there's the whole thing about AI outperforming some doctors in reading lung function tests.
That was a surprising finding.
It was. Although, to be fair, the source did mention that those doctors were actually performing below the national average.
So not the comparison.
Yeah. But still, it gets you thinking, like how is AI being used in these tests?
Right, like what are the algorithms doing? How are they analyzing the data?
Exactly. I mean, the fact that AI can, even in this limited context, outperform some human doctors just kind of blows my mind.
Yeah, it's definitely a sign of things to come.
So moving on from lungs, we come to blood sugar, and that's where things get really interesting. The source talked about how AI can actually predict and prevent low blood sugar or hypoglycemic episodes in people with diabetes.
That's a game changer for people managing diabetes, for sure.
Right. It seems like that could really improve people's quality of life.
Absolutely. And it's a great example of how AI can make medicine more proactive and personalized.
Okay, I like that. Proactive and personalized. So instead of just reacting to high or low blood sugar after it happens.
The AI can actually anticipate it.
Wow.
Yeah, and then it can alert the person so they can take steps to prevent it from happening.
Like what kind of steps?
Well, it could be as simple as eating a snack or adjusting their insulin dosage.
So it's almost like AI is acting as a personal health assistant, looking out for you and anticipating your needs.
Exactly. And the system that they highlight in the source is Medtronic's Sugar IQ system.
Interesting. So that's just three areas where AI is already making a difference. But the source mentions so many other medical fields that are being impacted.
Oh, yeah, there's a ton.
Like what?
Well, for starters, nephrology, gastroenterology, neurology.
Wow, so many ologies.
Right. And it's not just those. AI is also being explored in cancer diagnosis and even interpreting medical images.
That's incredible.
It is. And in cardiology, they're even using AI to predict cardiovascular risk.
Really?
Yeah, which could have a huge impact on preventive care.
I can see that.
And then in gastroenterology, AI is helping to analyze images from colonoscopies to better detect polyps, which can be a precursor to colon cancer.
That's amazing.
Yeah.
AI is clearly already doing so much more than I even realized.
And this is really just the beginning.
It feels like we're on the verge of this huge shift in how healthcare is delivered.
Yeah.
But it's probably not all smooth sailing, right?
Well, the source did mention some hesitation from doctors about embracing AI.
Yeah, that makes sense.
It's understandable, though. There are a lot of unknowns. It's new
Yeah.
territory for a lot of them.
Right. And I can see how it would be kind of intimidating for doctors to have this technology that can analyze data and make predictions in ways that maybe challenge their years of experience.
Yeah, I think that's part of it. The source actually lists several reasons for doctors' hesitation about AI.
Okay, like what?
Well, one big one is a lack of training.
Makes sense. I mean, it's not like they teach you how to use AI in med school, right?
Right. And most doctors haven't had the opportunity to really learn how to use and interpret AI-powered tools effectively.
So it's kind of like giving someone a super powerful instrument, but not teaching them how to play it.
Exactly. And then there's the fear of being replaced.
Which, is understandable.
Absolutely. But on the flip side, The source also talks about how AI could potentially reduce administrative burdens for doctors.
Which I would think doctors would be all for.
You'd think so, right? But it's complicated.
Oh, so.
Well, doctors are already overwhelmed with electronic health records.
Oh, yeah, I've heard that's a huge problem.
It is. And adding AI tools into the mix could actually make things worse in the short term.
So it's not a quick fix.
No. It really requires careful planning and integration to make sure that AI is truly helping doctors and not just adding to their workload.
That makes sense. It's not just about the technology itself, but about how it fits into the existing system.
Exactly.
And then there's the psychological aspect of it all,
Mhm.
Like, if you've spent your whole life mastering this complex field like medicine.
It's got to be tough to accept that a machine could potentially do some aspects of your job better than you.
Yeah, like I'd probably feel a little threatened.
And that's why the fear of being replaced by AI is so real for many doctors.
But I thought the source said that AI is more likely to complement doctors, not replace them.
Right, that's the key takeaway. It's not about AI taking over. It's about humans and AI working together.
Combining their strengths.
Exactly. AI can handle the data crunching and pattern recognition, while doctors can focus on patient interaction, making complex decisions, and providing that human touch that machines just can't replicate.
Okay, that makes me feel a little better.
Good, because that's really where the future lies. And that's where the source's concept of the augmented doctor comes in.
Augmented doctor, what's that?
So it's basically about training doctors to be proficient in both medicine and digital technologies.
So they understand how to use AI effectively in their practice.
Exactly. It's like being bilingual, but for healthcare.
I like that analogy.
So you've got doctors who are fluent in both the language of medicine and the language of AI.
That makes a lot of sense.
It does. But even if AI doesn't replace doctors entirely, it still brings up a lot of ethical questions.
Oh, for sure.
Like, with all this constant monitoring that AI enables, are we creating a whole new definition of healthy?
That's a good question. I mean, what does healthy even mean if your every heartbeat and glucose level is being tracked and analyzed by algorithms?
Right. And are we going to get to a point where we're just constantly being bombarded with data and alerts, even if we feel fine?
Yeah, and who decides what a normal reading is or what a healthy pattern looks like? That seems pretty subjective.
It is. And these are all big questions that we need to figure out as AI becomes more and more integrated into healthcare.
And it's not just about individual health either, right? There are societal implications too.
Absolutely. Like, what about people who can't afford these technologies?
Or people who just choose not to use them,
Yeah.
will they be at a disadvantage?
It's definitely a concern. We have to ensure that access to AI-powered healthcare is equitable and that we're not creating a two-tiered system.
Where only the wealthy or the tech-savvy get to benefit.
Exactly.
So it sounds like AI in medicine is this kind of double-edged sword,
Yeah.
It has the potential to do so much good, but it also comes with these ethical challenges that we can't ignore.
It's complex. Lots of nuances to consider.
Yeah, it definitely seems that way. We've covered a lot of ground today, and it's clear that AI is already transforming medicine in some pretty significant ways.
It really is.
But it also feels like we're just at the beginning of this journey.
Oh, yeah. This is just the tip of the iceberg.
And there's still so many questions to answer and challenges to address.
Absolutely. It's a rapidly evolving field, and we need to stay informed and engaged as AI continues to shape the future of healthcare.
I think pivotal moment is the right way to describe where we are right now. AI has the potential to be such a force for good in medicine, but we need to make sure it's used responsibly and ethically.
Couldn't agree more.
And for those listening, I'm curious, what's been the most thought-provoking part of our discussion so far? What stood out to you?
It has, yeah. It's exciting and a little scary all at the same time.
I think what's really got me thinking is the idea of AI actually, making life or death decisions.
That's heavy stuff.
It is. It's one thing to have an app tell you about an irregular heartbeat,
Mm.
but AI guiding cancer treatment or even, surgical decisions, that's a whole other level.
It is. It really makes you think about how much trust we're willing to put in these systems.
Right. Like, the source we've been looking at does a great job of explaining what AI is doing in medicine.
The what? Yeah.
But it's up to us to figure out the so what? What are the implications of all this?
Exactly.
So as AI starts playing a bigger role in healthcare, we have to ask ourselves some tough questions.
Definitely.
Like, what happens if AI makes a mistake? Who's responsible?
And how do we make sure that AI is used ethically? That it doesn't create bias or discrimination in healthcare?
Those are huge questions.
They are, and they don't have easy answers.
No, they don't. So where do we go from here? What's the next step?
Well, I think the first step is to keep the conversation going.
To keep learning and asking questions.
Exactly. We need to involve everyone in this discussion: doctors, patients, policymakers, ethicists.
Because ultimately, the decisions we make about AI in healthcare are going to affect all of us.
That's right. This isn't just about technology, it's about the kind of future we want to create.
A future where healthcare is more accessible, more effective, and more equitable for everyone.
And where technology is used to empower both patients and doctors.
Well said. Well, I think we've covered a lot of ground today, and it's clear that AI is already having a profound impact on medicine.
It really is. And it's only going to get more influential in the years to come.
So to everyone listening, I encourage you to keep learning, keep questioning, and keep the conversation going, because the future of healthcare is being shaped right now.
And your voice matters.
And remember, even though we've reached the end of this deep dive, your journey of discovery is just beginning. There's a whole world of information out there waiting to be explored.
So much to learn and so much to discover.
So until next time, stay curious.